continues to face a shortage of both primary and specialty care physicians. Most medical students graduate with greater than $150,000 in student debt, and yet most Oklahoma physicians are homegrown. Do you have plans how to incentivize medical students and resident physicians to stay in Oklahoma? And what plans do you have to help reduce their debt?
I don't know that I can personally help reduce their debt, but I can tell you that, you know, living in rural Oklahoma, you see it every day, and traveling around the state as you try to visit with people in all corners of Oklahoma, you see those areas that are clearly impoverished and certainly in need of additional medical providers. So when we have an opportunity as a state, when we cut appropriations to higher education, we need to also understand that that has an impact on our medical schools and our nursing schools and our allied healths. So we do not need to be in a position that in an effort just to try to save state budgets, that we are causing tuition to be increased so much that students either feel like they can never get out of debt, or they feel like they can never own a home, or they feel like they have to go out of state, or enter even a specialty where they think they may make more money than a general practitioner in a rural part of Oklahoma. We have to work with rural communities, and some of our large medical corporations, our hospitals, are doing a good job of trying to reach out to students and trying to say, hey, we will help you if we can place you in some of our facilities around the state of Oklahoma. That doesn't work for everybody, but it's a great start for those that are doing it right now. The state must partner with our medical providers to figure out, first of all, how we get students to continue to want to go to medical school or the related fields. And then secondly, what's the best recommendation that our students can give us as to what it will take to keep them here. Sometimes we have been able to work with rural counties that say if you come for 4 years or 5 years, we'll help pay down towards your debt. But it doesn't do any good if as soon as that's over, they end up leaving and going back to Oklahoma City or Tulsa. Sometimes that's because they've started a family and they feel the need to leave to go to another community. So we have to try to figure out a way to let our students know that they are vitally important in our rural state.
That's something that hits very near and dear to our heart. I don't even want to know what your debt is right now, but I know it's out there. But certainly it is a huge factor for our young folks who are coming out of medical school. I think the average cost is about $160,000 of debt when our students graduate from medical school. And that's one of the reasons why we have a shortage of primary care physicians, because you do have that huge debt. And it is hard to get these primary care physicians out to the rural areas, because many of them look at specialties because they know they have a huge loan to be paying back off, and so they look at where can they go to make the most money to pay off that debt sooner. And they may have families, and hopefully will have families to start. So paying off that debt's a big concern. The legislature passed some legislation recently in trying to help with student loans, making sure that we have the funding there in our state government budget to help meet those needs of encouraging our students to stay in the state, work in the state of Oklahoma. We have a great physicians manpower council that helps try to get our young doctors out into the rural areas and helps with some of that loan debt that you have as our students. But as I said, in my 4 pillars, my top goal in the state is to work on creating a better business environment and creating jobs and opportunity. And as I create jobs and opportunity and work on keeping taxes low, lowering the workers' comp, working on tort reform, and doing things that will make Oklahoma more business friendly, we'll be able to grow those jobs, grow our revenue base, so we can put to residency programs, so we can put into higher ed, so we can put more money into education, to raise the bar on education so that we'll have the quality academic skills in math and science for our students who will hopefully go into the medical profession, and thus provide the needs that we have out across the state of Oklahoma, and to be able to pay off those loans.